Good morning, everyone. Welcome to our Facebook Live session. We Love Nogales. My name is Pereira. I'm the Chief Medical Officer at Mariposa Community Health Center. With me, my esteemed colleague, Dr. Phil Williams. Dr. Williams, welcome.
Thank you so much, Dr. Pereira.
So before we begin, I want to thank Edgardo and his daughter for their kindness in making this possible. We're here in downtown Nogales, Arizona. Beautiful day. Just glad to be here to talk about some health issues. Buenos días. Mi nombre es Eladio Pereira. Soy el director médico de Mariposa. Conmigo mi colega, el doctor Phil Williams. Dr. Williams, bienvenido. Y gracias a Edgardo Muñoz y su hija por ayudarnos hoy en esta producción. We have a couple of things to review today from our session. I'm going to take advantage of Dr. Williams' expertise in pediatrics and cover the issue of well-child visits and maybe some of the childhood vaccinations. When we go to the pediatrician, we go for something that is a concern to the parents, but also to be checked for a checkup, particularly early childhood. Make sure there's growth, there's development, and all of that. Hoy vamos a hablar con las visitas de rutina con los pediatras y las vacunas. Cuando vamos con los pediatras vamos con una razón en particular, pero a veces vamos para un chequeo, para estar seguro que el crecimiento, el desarrollo de nuestros hijos e hijas es apropiado. Solo voy a pedir al Dr. Williams que hable acerca del propósito de esas visitas y quizás cubrir 2 o 3 de las vacunas importantes de la niña. So, Dr. Williams, let's talk about well-child visits. Why would parents bring their child? When is the first visit? From birth on? Can you summarize with us what's going on?
Of course, great question. So, in terms of well-child visits, they're probably one of the more important things that a pediatrician does. And the purpose of a well-child visit really has a few things that we look at. The first thing that we look at is the development of the child. So, for instance, are they meeting what we call developmental milestones? So there's a long list, and it's based on by age of, we want to make sure that kids are doing at a certain age what they're supposed to be doing. As an example, at 2 months, kids are supposed to be able to smile. By 6 months, they roll over both ways. They also sit up on their own. By 9 months, they should start to crawl. By 12 months, they start to walk. So we look at what we call gross motor, fine motor, and also their speech. By 15 months, kids, they should know roughly 3 to 5 words. By 18 months, they know 8 to 10 words. By 2 years old, it jumps up a lot to around 50 words. So those are all things that we keep a very, very, very close eye on, which is why, especially the first 2 years of life, we'll see the kids really every 2 to 3 months. So we see 2, 4, 6, 9, 12 months. And then, it's important to know because anytime kids have delays in any of those milestones, we need to figure out why. If a kid has speech delay, there's certain things that we look at. If kids have motor delay, either gross motor or fine motor, there's other things that we look at. And, we're taught early in pediatrics that early intervention is by far the most important thing because if you do notice any delays, we're able to quickly address those. Meaning, if a kid is not meeting, they're not saying roughly 50 words by age 2, there's things we can do. We can do a hearing test. We can refer them to speech therapy. If kids have other signs of motor delay, we'll start them in physical therapy very, very early on. So again, the main point is to identify and then to try to address whatever issues.
El doctor está repasando la importancia de las visitas desde el nacimiento hasta 2 años. Vemos el niño o la niña cada 2 o 3 meses para monitorear el crecimiento y desarrollo, la altura, el peso. Y cada visita el doctor hace preguntas dirigidas a determinar si ese crecimiento y desarrollo es normal. De sonreír, de gatear, de caminar. Y si vemos que eso no está sucediendo, tenemos que tomar medidas. Tenemos que tomar medidas. Y si vemos que el crecimiento y desarrollo es normal, de sonreír, de gatear, de caminar. Y si vemos que eso no está sucediendo, tenemos que tomar medidas. Y si vemos que el crecimiento y desarrollo es normal, de sonreír, de gatear, de caminar. Y si vemos que eso no está sucediendo, investigar por qué. Entonces referirlo para otras pruebas adicionales con un especialista, con una terapista del habla, una terapista física, para tratar de identificar cuál es el problema, ¿no? Y recibirlo. Great. And so what about a couple of things? Tell us about lead. Lead is present still in all houses with old paint. Some of the kids scratch the paint with their fingernails and they ingest it. What is lead and what are we concerned about it?
Great question. So, lead, just like you mentioned, is more commonly in older homes, especially homes built before 1975. And, as you know, kids, they put everything in their mouth. So if you live in an older home, they commonly, will scrape things and may scrape something off the wall, put it in their mouth. So it's one of the things that we look for. So we check a lead at least twice in childhood, at 12 months and then also at 24 months. And after we test the kids, it'll basically give us a level. So there's certain lead amounts that we consider worrisome. And it's a problem because lead toxicity can cause a lot of different issues. One, classic medical school question that we get is it can actually change the structure of the red blood cell. It can cause basophilic stippling.
Yeah.
I'm sure you remember that term from med school. But then also the main, clinical thing is that can cause intellectual delay, developmental issues.
Right. So el doctor está diciendo que es muy importante la evaluación para plomo que está presente en las pinturas en muchas casas construidas antes de 1975 y en la visita en ciertas oportunidades el médico puede tener un nivel de plomo en la sangre. A largo plazo puede causar no solamente anemia, problemas en la sangre, sino problemas neurológicos, problemas psiquiátricos, retrasos en el desarrollo. So, uno de los propósitos de la visita con el pediatra es monitorear y identificar toxicidad del plomo. What about vaccines? MMR has been around for a long time. It does reduce the risk of those diseases. Can you talk about the MMR vaccine and what it contains?
Of course, the MMR is given starting at age 12 months, so it helps to cover for three things, so measles, mumps, and rubella. So measles, the classic, it can cause a lot of issues, can cause really severe rash, really high fevers, can also cause neurologic issues, just can really devastate the body. The good thing about measles is that if you're vaccinated, the protection is extremely high. So definitely recommend it. Mumps is another illness that can cause, for instance, swelling of the parotid gland. It can also cause swelling of the testes. And then rubella is something that we see. It is, can cause, it was actually identified way back in the 1700s. It's what was called German measles, actually, is the original term for it. But, rubella, especially in kids, can cause something called congenital rubella. There's three major things that it can cause. It can cause eye issues. It can also cause changes in the hearing, and it can also cause intellectual disability. But again, the good news is that there's vaccines for all three. So it's a vaccine that you'll get starting at 12 months, and it's highly protective.
El doctor menciona que esta vacuna protege contra 3 enfermedades, el sarampión, las paperas y el sarampión alemán o rubella. Ya casi no vemos esas enfermedades por las vacunas. El sarampión puede causar problemas en la piel y puede causar inflamación en el cerebro y otras complicaciones. Es mejor que no suceda. Las paperas, donde se inflaman la parótida, otras glándulas, puede causar inflamación en los testículos, puede causar inflamación en el cerebro. Y el sarampión alemán o rubella, el doctor menciona que puede causar problemas en los ojos y problemas en el corazón que a veces requieren cirugía. Pero a través de la vacuna, con 2 inyecciones, se pueden evitar esas vacunas. The other vaccine is the meningitis vaccine that we give. It's really important to get that done around 11 or so, and maybe a second dose later, particularly before they go to college, so that kids are not prone to get meningitis, which is in some cases just deadly. And so it's called meningococcal meningitis. Okay. So estoy hablando de la vacuna de la meningitis que se administra empezando como a los 11 años y luego hay una dosis después para evitar meningitis o reducir el riesgo de meningitis cuando uno vaya a la universidad por la proximidad de un estudiante a otro. Great. Thank you, Dr. Williamson. Just two other points. In adults, let's not forget about the importance of colorectal cancer screening, colon cancer starting around age 45, and then aneurysm screening. Aneurysm is dilatation of the abdominal aorta, usually recommended for men ages 65, 75, who ever smoke. So dos pruebas de chequeo para cáncer del colon empezando a los 45 años. Todavía la mejor prueba es una colonoscopía. Hay otras alternativas como el Cologuard, pero en general la colonoscopía se hace de diagnóstico y de tratamiento. Si hay un pólipo, el especialista lo puede extirpar. Y la otra es una prueba para aneurisma en la aorta abdominal. Se recomienda entre la edad de 65 y 75 en hombres que han fumado. So those are the things that we recommend in adults. And then our last section is something that we never talked about before in this forum. We Love Nogales, but I think we should. It's time we talk about that. As you know, we've seen a dramatic increase in violence in our country, and that's not good, both physical and verbal. It looks like it just exploded, magnified, and I think through this program, we really think it's really important to speak about positivity and a good life, and promote good values among our colleagues, our friends, our family members, and those are values that bring joy to our lives, and those are the values of respect for each other, understanding of each other, dignity, and empathy. Empathy has to do with putting ourselves in someone's shoes and be thankful for what we have. Nowadays, we are very abrupt sometimes in creating premature conclusions about each other and attack each other, and that's not good. It really brings no benefit, and I think it's a source of tremendous stress. So we, in this program, we're going to start talking about how to do all of that, how to consider calm in terms of violence, consider respect versus disrespect, sympathy and empathy for each other. So, Dr. Williams, what are your thoughts?
Yeah, I've lived in a lot of different places, and I think, living here in Nogales, family is really prized, and I think that, that family network to me is so important. I think that, it's also important, to recognize whenever people aren't doing well. If you have a close-knit family, a close-knit community, it can be easy to recognize that, hey, this person isn't doing great. I think we're lucky here that we do have a lot of resources. If we've talked here before about our behavioral health program that we're rapidly expanding. We've talked about, having close connection with your physician if you do notice, any type of illness, including mental illness. But I think, it all comes back to looking after each other.
Muy bien dicho. Estamos hablando de los principios que son importantes en estos tiempos donde hay mucha violencia física, verbal, la importancia de principios sólidos que mantienen la comunidad saludable, principios de respeto, de dignidad y de empatía por todos. Tratar de ponernos en el lugar de otra persona y crear un círculo positivo en nuestros familiares, en nuestros colegas, en nuestros amigos. A veces no sucede, hay situaciones de salud mental, como dice el doctor Williams, que crean esos comportamientos. En Mariposa tenemos recursos para poder evaluar, diagnosticar y tratar esas situaciones. Pero aunque no haya salud mental, tenemos que seguir promoviendo la idea de esos conceptos positivos de respeto, dignidad, y tratar de promover a Nogales. A veces, desafortunadamente, los comentarios que hacemos de nuestro pueblo no son muy positivos, pero la realidad es que vivimos aquí, comemos aquí, compartimos aquí. Y en mi situación, donde tengo la oportunidad de compartir con otras personas, siempre promovemos el pueblo, la comunidad de Nogales, como un lugar muy bueno para vivir y compartir. Así que con eso vamos a terminar la transmisión de hoy. Doctor, thank you very much for being with me today. I hope this was useful. We'd like to get your feedback. We're going to keep talking about these concepts in the future. And with that, I think we're going to end our transmission. Muchas gracias por unirse a la transmisión. Gracias al doctor, a Mariposa, a todos por escucharnos y apoyarnos en estas sesiones. Tengan buen día. Muchas gracias. Hasta luego. Bye bye.